Hi, my name is Emily Fenno, and I did my internship at Mountainside Rehabilitation Clinic, which is an outpatient clinic in Sitka, Alaska. The link of my poster can be found in the description of this video below, or it is uploaded onto Canvas. My supervisor during the duration of my internship is Manoj Bhatar, who's a physical therapist at the clinic. I sat down with him for the project proposal and decided to research neuromuscular electrical stimulation, which is also known as E-STEM. I ultimately chose this topic as my supervisor and I were already familiar with E-STEM and because we were both interested in this topic. The project title of my project is Measuring Increase of Neural Drive in Quadriceps with Neuromuscular Electrical Stimulation. Basically, we just wanted to test and see if quadriceps strength would improve when using E-STEM. For the setup, I used a dynamometer woven through a gait belt connected to a patient table. And while this may not have been the most perfect configuration, it is what we had to work with for being in such a small Alaskan town. I had 4 participants in my experimental group and 4 participants in my control group who were both active male and females between the ages of 20 to 33 years old. And all the participants were either patients of the clinic or colleagues working in the clinic. And my job was to then assemble the setup, trying to always recreate it the same each time and conduct the experiment. For each participant, I screened them for any contraindications against using NMES on them, and then if they passed, I would then go on to describe what they would be performing, which was 5 full maximal contractions of their quadricep in each trial. And the highest reading from each trial would then be recorded into the data collection. I would explain what to expect and feel in the pre, during, and post E-STEM phases, and all the parameters that I use can be found on the poster in the link below. And the results of the 3 trials were just to see if in fact that strength improves by using NMES. I might have already touched on this, but the purpose of my project was just to see if NMES is an effective modality or an intervention in physical therapy to gain strength in muscles. And my project timeline was around 2 months or so. I did a lot of research by reading journals and articles on the internet on NMES, as well as understanding the parameters and how they can be influenced and affected. I also took time to practice NMES on my supervisor just to become comfortable with the device before applying it to any participants, which I was supervised the whole entire time when I did that. And the actual data collection itself took a few weeks due to patient scheduling and seeing when my colleagues were available to be tested. After I conducted all my research and gathered all my findings, we found that the results of the project were true to our clinical question, and that being post E-STEM strength or the force output for the majority of the participants in the experimental group was higher. And you can see this on the poster in the graphs I created and the main findings and the trends of all those. I want to note that there was one participant that did not have more strength in the post E-STEM. I additionally want to add that one participant tested 3 separate times compared to the other participants who only tested once. And you can see that in figure 3, I believe. And typically this intervention is used to rehab people with injuries or working on strengthening weak muscles. However, my participants did not have any of these at the time of testing. Normally, I would have liked to have tested people who were specifically rehabbing from an injury or a weak muscle or muscles, but due to time and not being an actual physical therapist, it was hard for me to do this and select a pool of right people. And again, due to time, I couldn't repeat this experiment multiple times just to confirm my theory is completely true. But from my experiment results, it does appear to be. and there were also many limitations that may have affected my experiment and overall project results. However, this intervention is a current application in the physical therapy world, so if it didn't show any significance in aiding the rehab of a person, this practice wouldn't be used. I used my knowledge of previous classes that I've taken towards this project. When I took Physics 1 and 2 in freshman year, I learned about electricity, current, and frequency, and how these parameters of NMES can be influence and affect muscles. And this was a direct application use in physics in a real life basis and a clinical environment. I also utilized Human Anatomy and Physiology 1 and 2 to understand muscular structures and their functions. Finally, this project allowed me to have a better understanding and appreciation of NMES as a physical therapy intervention and how its parameters affect neural drive and patient comfort. I will use my new knowledge and skills of NMES to become a more competent clinician in the future. Lastly, I just want to say that I thoroughly enjoyed my time being an intern here at Search Mountainside Rehabilitation Clinic, and I thank you so much for listening to my project summary. And of course, if you have any questions, please let me know. Thank you.